Okay. All right. So as I mentioned, the last workshop today is focusing on speaking. So in terms of today's session, I'm going to give you an overview of OET speaking. Then we'll review 3 key skills with some guided practice. I'll share some tips and tools to improve speaking, and at the end, we'll have some time for questions and answers. Let's start out with the basics of OET speaking. OET speaking consists of 2 5-minute role plays. Each role play is specific to your profession. So if you're a doctor, you'll play the role of a doctor. And you also will work with an interlocutor who takes the role of the patient or carer in each of the role plays. The whole test takes around 20 minutes. And if you're taking OET on paper, your speaking test will be in a room and face-to-face with the interlocutor at the venue. If you're taking OET on computer or OET at home, you will complete the speaking test online with the interlocutor on a secure version of Zoom. If you're taking OET on paper, your ID check is basically a check of your passport or valid ID. For OET on computer or OET at home, there are some extra security checks, including a check of your room and your person, such as showing the interlocutor your wrists, ankles, glasses, and so on, to ensure the test environment is secure. Then there's a warm-up, which takes around 2 to 3 minutes. Here, the interlocutor asks you some questions about your professional background. This is just a chance for you to get comfortable with each other's voices. Then you get your role play card and 3 minutes to prepare. The first role play goes on for 5 minutes. Then you get the next role card and another 3 minutes to prepare for the second role play. You will be able to see the role play card throughout the role play. Note that only your role plays are assessed. The only thing you're being assessed on is your role plays. And this is not the interlocutor who assesses you. There are 2 separate OET assessors that listen to your role plays and rate your performance using the speaking assessment criteria, which we're going to cover in the next section of this session. Now, now that we've covered the basics of OET speaking, let's take a closer look at the role cards. Each role card has 3 sections. The first section is the setting, which gives you clues about the conversation. Is this a routine or emergency health issue? Is the patient at home, visiting a hospital, or at a clinic? The next section is background information, which gives you relevant background details about the patient's age, the reason for the healthcare visit, and whether this is a first visit or a prior relationship. The background information also makes it clear if you are speaking to the patient directly or a relative of the patient. For example, if the patient is a child, you will be speaking to the patient's parent, and the card will say the child is not present in the room. The final section includes the tasks, which give you instructions about what to say. The verbs tell you the function of your communication, such as confirm, reassure, explain, while the information in parentheses provides examples you can use in your conversation. Before we look at some skills for speaking, let's understand how your role plays are assessed. Assessors mark your performance on linguistic criteria and clinical communication criteria. Our linguistic criteria determine how assessors will score your language skills during the speaking subtest. So when thinking of the 4 linguistic criteria, let's go through these together. We have intelligibility, fluency, appropriateness of language, and resources of grammar and expression. Those are the 4 linguistic criteria that you're assessed on. For the OET speaking subtest, assessors give you a score for each criterion. This is called a band score. Now, when thinking about the band score, what do you think the maximum band score is for each of these areas, each of these criteria? The answer is 6. You're scored out of 6 for all of these criteria. What you're looking at is the linguistic assessment criteria and the descriptors for each band score. See, I'm going to try to copy this here. You can find this document in the FAQ section of our speaking page, and I'm going to post a link in the chat as well. So you can find this on the speaking page if you go down to the FAQ section. The criteria also come with a glossary that explains the focus of each criterion. We want to recommend the speaking resource you should not miss. It's the Ultimate Speaking Guide, and part 1 is dedicated to the linguistic criteria, where you can find explanations, examples, including from a nursing role play and a medicine role play, and tips on how you can prepare. This can also be found in our speaking page. Second set of criteria are the clinical communication criteria. So let's go through these ones now. We have relationship building, understanding and incorporating the patient's perspective, providing structure, information gathering, and information giving. Okay. Do you know what the maximum band score is for all of these? These ones are actually assessed out of a score of 3, so from 0 to 3. In here you can see all of them. Assessors look at how you demonstrate the indicators under each criterion across both role plays. You should not treat them as a checklist to try to cover in each role play. You're marked from 0 to 3 for each of the clinical communication criteria. For the linguistic criteria, the clinical communication criteria, both of them have a glossary which explains each in more detail. And for the clinical communication criteria, we recommend our Ultimate Speaking Guide Part 2. So Part 1 focuses on the linguistic criteria. Part 2 is focusing on the clinical communication criteria. This is also on our speaking page and is a must-have resource. It's got plenty of real audio examples and tips to help you determine and demonstrate the criteria. You should aim to achieve the highest level in the descriptors for each criteria. Test takers that are looking for a score of B will have achieved mainly scores of 5 out of 6 in the linguistic criteria and 2 out of 3 for the clinical communication criteria. So that's what you should be aiming for. All right, so in this next section, we're going to focus on 5 ways that you can improve in the OET speaking subtest. The first is to initiate the interaction confidently. This is all about getting the role play off to a good start, as first impressions really matter. But first, I want you to think about this question. I'm going to give you 10 seconds to answer in the chat. True or false? There is only one correct way to start an OET roleplay. What do you think? Go ahead and write your thoughts in the chat. All right, the answer here is false. There's more than one way to start an interaction, right? There's not only one. Okay, there's a couple different ways that you could do this. All right, so let's go ahead and talk about this now. Let's refer to the speaking glossary for an explanation. As part of the criterion relationship building, initiation involves greeting the patient, introducing yourself, clarifying the patient's name, and clarifying your role in care. In real life, the first words of any conversation with a patient could reduce their anxiety or raise it. This is why it's so important to begin all interactions in an appropriate manner for the context given in the background information. Now, let's try a task. On the left, you can see an introduction, a way that you can start a role play. On the right are different summary options of different situations. So take a minute to read the opening on the left and the description of the situation on the right. So it says, "Hello, Jane. I can see you're in a lot of pain. I can give you something for that, but I just need to ask you some questions first. Is that okay?" So that will give you an idea of what the opening is. Now, how would you describe that opening? A, B, C, D, or E? Go ahead and write your ideas in the chat. A, B, C, D, or E. What do we think here? All right, so the answer here would be C. This is a pretty urgent type of situation, right? This is pretty urgent. They're talking about they're in a lot of pain. They want to get things going. So this would be what we consider an urgent situation. Okay, letter C. Now I have a second one here. "Hello, Jane. My name is Dina. I'm one of the doctors who's been looking after your daughter. I've come to give you an update and ask a few questions. Is that okay?" So how do we describe this interaction? What do we think here? Go ahead and take some time to think about this one. And we have also, yeah, which letter would you use to describe this one? Right, this one would actually be D, an anxious parent. This is an anxious parent that's worrying about this one. Okay. So that's how we could describe this situation. An anxious parent. Okay. So now you have three more openings here, 3, 4, and 5. And then there's three more types of descriptions of how you would describe these. So go ahead and match the rest of these together. I'll give you 30 seconds to do that starting now. Okay, let's go through these together. Take a few more seconds to write your ideas in the chat. Okay. All right, so number 3 is letter E. Number 4 is letter B. And number 5 is letter A. Okay, that is what we have here for our remaining options. Okay. Now, as you saw, there were very different openings, but all of them were appropriate to the situation. So take a screenshot of this for later reference, but remember these are examples only. This is not the only way to start a role play for these situations. The best introductions will be personalized to the patient and their healthcare situation. Okay. Now let's try another task. This time, the setting and background information are on the left. Choose the most appropriate way to start the interaction from the options on the right and post your answer in the chat. So go ahead and read the setting and the situation on the left and choose which letter is the best way to start out this interaction, A, B, or C. Go ahead and take about maybe 30 seconds to do that as well. All right, so the answer here is letter C. All right, so based on the information that you've been giving, the best way to start this interaction is letter C. Okay, very good. I saw that you guys have written that in here. Okay, so now for this final task, you tell me how you would start this interaction. What are some things that you would mention at the beginning of this interaction? Okay, take about 30 seconds to write some thoughts here. How would you start this interaction? All right, let me go ahead and put the timer on. Oh, there we go. All right. All right, saying that you're one of the doctors, here for registration. Do you have any questions? Great, these are all great ways of how you would maybe start out the interaction. Very good. Well done. So let's move on to the second way in which we can improve your speaking, and that is to elicit and explore. That's our next way we're going to talk about here, elicit and explore. So let's go back to our assessment criteria glossary to see what this actually means. Here we see that we need to Elicit and explore the patient's ideas, concerns, expectations as part of the criterion understanding and incorporating the patient's perspective. I'm going to play a short clip of a part of a conversation between a patient and a healthcare professional. Listen and tell me if the healthcare professional explores the patient's concern. All right, so while you're listening, think about this. Is the healthcare professional exploring the patient's concern? What do we think here? All right, I'm going to share the sound. Let's go ahead and play this.
Now, I think you're ready to start exercising again. I'd like you to go for a walk each day, just a few minutes to begin with. It's important for your recovery and also really good to help with your anxiety. How does that sound?
I'm not sure I feel ready to walk on the street.
There's nothing to worry about. Just a few minutes each day will be so good for you. Now, let's talk about your physiotherapy.
Okay. So this, so what do we think? While you're thinking about this, I want you to think about this. Is this, did the healthcare professional explore the patient's concern? What do you think? Go ahead and write that in the chat. What do you think here? All right, so yeah, we can see that that's right. She doesn't really explore it. She just kind of goes right on and talks about the next piece of information. She's not exploring the concern.
Now, I think you're ready to start exercising again. Now, I think you're ready to start exercising.
This is just a transcript, what we talked about. So, okay. So let's listen to another version, and I want you to think about how this does the same thing. Maybe this is better or worse at exploring the concern. Just think about this different. Listen to this other version as well.
I'm not sure I feel ready to walk on the street.
Okay, what worries you about walking on the street?
Oh, I just don't feel safe on my own. I'm worried I'll fall over again or something.
I see. You feel vulnerable walking alone. I can understand that. So, how about we get someone to join you? A friend, perhaps?
Oh, that would be good.
All right, so this one, she does do a much better job of exploring the concern, right? Give some solutions, give some ideas. She explored the concern with an open question. She paraphrased his feelings, showed empathy, and offered a suggestion related to this concern. So all of those things were things that she did. Let's move on to the third way you can improve, and that is to use appropriate questioning techniques. Understanding how to choose between open and closed questioning styles at different points of the interview is important in the patient-centered approach. An effective healthcare professional uses open questioning techniques first to understand the problem from the patient's perspective. Later, the approach becomes more focused with increasingly specific and then closed questions. So open-ended questions, for example, what brings you here today? Can you tell me more about that? How have you been feeling since I last saw you? Those are answers, questions that are, trying to get you to give a lot of information, right? They invite the person answering to give more information. In closed-ended questions, are you Are you exercising regular? Is the pain getting worse? Have you had a similar rash before? These types of questions you answer with just a yes or a no. They're not eliciting extra information. They're just trying to get the person to say yes or no. So let's first complete these questions you might find yourself asking in consultations with patients. So go ahead and let me know how you would complete these questions. All right, so let's go through these. Can you tell me a bit more about your pain? Do you find the pain worse at certain times of the day? What have you done to manage the pain so far? So what brings you here today? All of these are different ways that you can answer this question, okay? There are different types of questions that you could use. So now, think about a consultation that you might have with a patient. How would you put these questions in order? Which one would you ask first, second, third, fourth? Put these questions in logical order. All right, I'll give you 20 seconds to do that. And write your answers in the chat. You can write the letters. All right, so let's go through these. As you can see, the first couple of open questions aim to understand the problem from the patient's perspective. Later, the approach becomes more focused with increasingly specific and then closed questions. Okay? There are two types of questions you should avoid, and those are compound questions and leading questions. Compound questions are when you ask two or more questions in one go. The problem with compound questions is that they lead to ambiguity. The patient may not know which aspect of the question to answer, and a leading question is one that pushes the patient to a particular answer. They are part of the criterion information gathering. All right, so these are, the types of questions that we might want to avoid. Being aware of the type of questions you are asking is important, as you can easily change your questioning once you know what you want to do and what you should avoid. So let's think about how would you change this leading question to an open question? Okay, so we have you're not exercising much. That's a leading question. It tries to lead them to answer in a specific way. Okay. And then the next one here, how would we change that to an open question? Would be something like this. how often do you exercise? Right? You're not exercising much. You're kind of suggesting that they should say no, right? You're kind of leading them to a specific answer. But if you say, how often do you exercise? That is a much more open-ended question, right? It's saying, it allows them to answer with a lot more information. Next one, we have this leading question, or I guess this is more of a compound question. Is the rash sore or itchy or bumpy? How would we change that into an open-ended question? We could say something like this. Can you tell me about how the rash feels? You're inviting them to provide information and descriptions of how they feel, rather than just saying, is the sore, rash, or itchy or bumpy, right? You're not leading them to give you a specific answer. You're inviting them to share their information. The next way you can improve in the speaking subtest is by chunking and checking when you give information to the patient. So let's see what it means to chunk and check information. All right, so I'm going to play an audio, and you need to tell me if the speaker pauses enough and checks that the patient is understanding, okay, when they're speaking to the patient. So let me go ahead and play this now. And I want you to think about this question. Does the speaker pause and check the patient understands?
So, what I'd like you to do is visit the community health center. There are classes there, exercise classes and relaxation and breathing sessions. I'd like you to try a few classes 2 or 3 times a week for the next few weeks. Also, I'd like you to make an appointment with a dietitian.
Okay, so what do you think here? Does the speaker pause and check that the patient is understanding? What do we think here? The answer here would be no, right? As most of you guys wrote already. Very good. Yeah, they did not
So,
check.
what I'd like you to do is visit the community health center. There are classes there, exercise.
Yeah, it didn't pause at all. She does not pause at all or check that the patient is understanding. Information giving is one of the clinical communication criteria, right? So, there's different indicators here, E1, E2, E3, E4, E5. These are ways of kind of showing how you give information effectively, okay? I'm going to play the same conversation again, but this time the speaker does some things differently. Tell me in the chat what you think that she does differently, okay? Let me go ahead and play this one here.
So, what I'd like you to do is visit the community health center. Do you know where it is?
Yep.
There are classes there, exercise classes and relaxation and breathing sessions.
Okay.
I'd like you to try a few classes 2 or 3 times a week for the next few weeks. Would that be manageable?
Uh, I'm not really sure how these classes will help.
It seems like a small thing, I know, but these activities can make a big difference to how you're feeling, and lots of people find a big change in their anxiety levels.
Okay, that makes sense, I guess.
So, do you think you can manage 2 classes a week?
Yeah, I can do that.
Okay. So what do you think that she did differently here? What do you think? Write some ideas. All right, so yeah, we have, one thing would be all the things that are listed on the slide, right? She asked about what he already knows. She paused. She invited him to contribute and check for understanding with questions. So all of these things are great ways of chunking and checking, putting things in groups of information and checking to make sure that they're being understood.
So what I'd like you
All right, and for the final way you can improve your speaking is by staying away from pre-rehearsed or memorized phrases. So in an attempt to reassure your patient, you might use phrases that sound empty without meaning to. What you should do instead is listen, accept, or acknowledge the patient's view, and then offer reassurance based on what you have heard them say. So you should avoid phrases like, don't worry, you don't know, you don't worry about that, nothing to worry about. So for example, if the patient says, I think my father is dying, it wouldn't be a good idea to respond, don't worry about that. Instead, you should do things that are a little bit more specific to that answer. I'm worried I will have a scar forever. I absolutely understand that you're worried about that. This particular surgery can leave a small mark, but there are lots of ways to help prevent scarring, which we'll go through. So much more specific and helpful to the patient. Checking that a patient has understood something in a mechanical way can prevent the patient from telling you if they have actually understood. You can check more authentically by using more natural expressions or by personalizing your checking based on the information you have shared. So mechanical checking would be like, is that clear? Are you getting my point? Is that clear to you? Why do you look so nervous? Checking more authentically would be, using things like, does that make sense so far? Is everything clear for you for now? What do you think about that? These are kind of more authentic ways of checking. Or make it a little bit more personalized. How do you feel about that medication plan? So you're making it specific to exactly what you're talking about. Okay. In the same way, formulaic or memorized phrases for empathy sound empty and may have the opposite effect, right? I know your concern. I understand your concern. I know how you feel. Instead, be specific, echoing the patient's feelings and personalize what you say. I know the thought of surgery can be scary. It's all right to feel anxious about the test, much more personalized and specific to the patient. All right, so for this activity, we're going to try and see if you can recognize some of the skills that we just talked about. So I'm going to play part of a role play where a nurse is talking to a patient. Take notes as you listen and notice what clinical communication skills the nurse demonstrated. When you're ready, post your answers in the chat. Let's go ahead and play the role play. And then I want you to take note of what the nurse did well. What are some of the skills that we talked about that the nurse used in this conversation?
Hello, Dina. It's me, Nurse James from the clinic. I'm here for your checkup and to see how you're doing. How are you feeling today?
Actually, not great today.
Oh, that's no good. Can you tell me what you mean by not great?
Well, I've got this sore spot on my back, my lower back, and I've just worried that it's a bed sore.
All right. I can see you're quite uncomfortable. So let me ask a few more questions before I have a look, and we'll take care of it, all right?
Okay.
So you said you've got a sore spot on your back. Can you tell me about how it first came on?
I guess I noticed it yesterday, and it's sort of a sore spot at the base of my spine.
Okay. So you first noticed it yesterday, and it's down low on your back. Can you explain the pain to me?
It's itchy, and it feels kind of warm and firm.
Firm. I see. That must be uncomfortable for you.
Yeah, I'm quite worried about it.
I can appreciate that, especially because you've been in bed for a while now after the surgery. So I'll have a look in a moment, but it does sound to me like a pressure ulcer, which is just another name for a bed sore. You mentioned that word before, so how much do you already know about bed sores?
Okay, so go ahead and take about 36 seconds to write what are some things that the nurse did well. What are some of the clinical communication skills that were used? Based on what we just talked about and those skills we focused on, what do you think that this nurse did well? Go ahead and write some thoughts, and we'll go over this together. All right, so let me share some ideas here.
Hello, Dina. It's me, Nurse James from the.
He initiates appropriately by introducing himself and his role. He explains the purpose of the visit and asks an open question. He shows empathy. Oh, that's no good. He asks questions to clarify. Can you tell me what you mean? He uses signposting language. Let me, before I. He summarizes what the patient has said, demonstrates active listening, and shows authentic empathy, and asks what the patient already knows about bed sores. So all those are things that he did well. Let's finish with some resources to help you improve your speaking for OET and beyond. All right, so of course we have free complete sample tests on the OET website. Most of the other tests might give you some free sample tests, but we're proud to provide complete sample tests that you can really test yourself before test day. You can download the sample test and use it to practice in person with a friend or colleague. So that would be the format for paper-based, or practice via Zoom or other social media, which is the format for computer-based or OET at home. These two booklets explain the assessment criteria OET uses to score your speaking. They are full of helpful explanations of what the assessors are looking for and useful language you can include in your role plays. They include more examples of the nurse that we heard in the webinar completing this role play, as well as a doctor and a speech pathologist completing their role play specific to their profession. So you can hear where each one demonstrates strength and weaknesses, and you can find them on the speaking page, which is the same link that I already pasted in the chat. We also have our own official OET speaking course. This is 100% online and self-directed, so you can study when and how you want. It has a huge amount of training, including skills, strategies, and new sample tests, including real tests with assessor scores and comments. There are also some useful language workbooks at the end to work on your grammar and vocabulary. The course is available via the OET store. Okay. Before moving on to take any questions you might have, I would like to offer some extra tips to consider when preparing for OET speaking. First tip here, practice speaking in a variety of situations. Imagine speaking with patients in different settings, such as a hospital, their home, or clinic. Choose a friend or family member to role play with. Explain the skills you need to demonstrate, ask for their feedback. Use the resources on our website, such as the sample test and our YouTube channel. Record yourself on your phone, listen back, and try to self-evaluate your speaking. Make a recording of different phrases or record of different phrases, which you could apply or adapt to different situations. Pay close attention to functional English, such as advice, explanations, questions, empathy. And lastly, consider working with a teacher for expert guidance to identify your weaknesses. So actually brings me to the end here. So I'm going to go ahead and stop sharing my screen and turn it over to you for any questions. Thank you again for your participation in these webinars. This is the last one of the series, so I really do appreciate you taking the time to engage in this. And while we're taking a look here, any last minute questions that you might have? Okay, well, if there's no questions, thank you very much. Have a great rest of your day. And I hope to do some more sessions like these in the future. And if you are going to be testing soon, best of luck on your OET test.